We're back together at Liberty Conspiracy Audios. LibertyConspiracy.com is the website. You can find us at iTunes under Liberty Conspiracy. You can also sign up over at LibertyConspiracy.com for the iTunes subscription. And if you're interested, Podomatic is the place where all of our audios are stored. You can go all the way back in our archives to when we first started a number of months ago, when we only had about 300 subscribers. Very, very few subscribers. We're now at 17,000 subscribers. So if you're new to it, thank you so much for showing everybody out there that there are other people like you who believe in this nefarious conspiracy for liberty. Yeah. Hey, we got a couple issues that I mentioned in the last production I was going to package as one big program. I thought it was incumbent on me to not overdo it in the last one, and I decided to split these off and put them in their own production. I thought that would be very useful. It's a lot of work watching all the things that they're doing down in Washington, D.C. to mess around with my neighbor's freedom. And, I mean, it's incredible. There's so many things happening so fast. You just see this massive, massive pile of work out in front of you. It's sort of like the barber who must have been there when they took the mask off the man in the iron mask, like, uh-oh, I got a lot of work ahead of me. So here it is. We're packaging these two pieces together in healthcare reform and financial regulatory reform. And so we're going to start with the medical issue first. And even as I record this, I'm not even sure if I might split this into two pieces. I don't even know. It's just absolutely a huge, huge undertaking to look at all these things, actually study what they're talking about, and try to go through the history of how we got here to this point as citizens under this increasingly tyrannical U.S. government, which doesn't care a whit about the rules they swear to uphold. And remember, I'll tell you at the outset, I'm a person who believes in total individual freedom, individual liberty, and free markets. And I don't believe government is ethical in any way whatsoever. Even the small government that people claim is a pretty decent thing under the Constitution. Hey, I'd be satisfied with that. Small spheres of competing government, if I could get to that, that would be okay with me. It'd be a heck of a lot better than the massive socialistic, tyrannical, one-size-fits-all system that we have coming out of the federal government. Absolutely amazing. So it's time for us to try to grapple the first issue, health care reform. And I want to pay particular attention to the use of the language here. This is very important. First, as we go through some of the information that we've derived here that I've gotten from audio, I want you to watch out for the way that people use the word we and our, okay? And then think about the term reform. There are two connotations for the word reform. The first is the pure definition of reform based on the idea of reforming something or restructuring it, as in the Reformation back in history. The second one is sort of in modern parlance nowadays. It connotes rehabilitation. To rehabilitate something that's gone bad, like a criminal. To reform him, make him better. So I think you get the drift here. In the pop media and the political world, the reason they're using the term reform is that they want to make you instinctively feel in your gut that they're taking something bad and making it good, making it better. Well, just to let you know, it's not in the federal Constitution to allow Congress or Obama to reform any private business. That's a particularly annoying thing that seems to be happening nowadays. We've got two pieces of audio to listen to and one on reserve for its own spotlight on a separate podcast where I'm probably going to let it stand pretty much on its own with only an introduction, conversation in the middle, and some information at the end. And some of this stuff is truly remarkable when you put the dots together, when you bring everything together and you see the plan, this very deft plan that they've been working on for quite some time. First, I want to turn to NBC News as Brian Williams introduces the amazing pop media report on Barack Obama's speech in front of the AMA.
Today, President Obama saved the longest longest speech of his presidency so far for one of the diciest issues he will take on as president, health care in America. There were doctors at today's American Medical Association gathering who booed the president, who warned them they wouldn't like everything they heard from the president in this health care debate that has never left everybody happy afterwards. Our chief White House correspondent Chuck Todd standing by tonight with more on this. Chuck, good evening.
Well, Brian, as you know, health care is a complicated issue, so that's why it may have taken so many words for the president to address this in Chicago today. And it kicks off what's going to be a summer-long battle to reform the health care system.
There it is. There's the word reform. You got it. And we'll hear this all the time from these people. And we'll hear we and our, this all-inclusive. If they can set the groundwork here, if they can set the field up the way they want it to, and have everybody thinking as a group, it's our healthcare system. It's not the insurance company with which you contract, the doctor you go to see. It's all ours. Everybody's decisions have such direct consequences on everybody else that there's only one thing we can do. We can only manage it through government. That's it. It's we. It's us. There's no I. Reminds me of that book, We, that was banned in the Soviet Union, and, of course, Anthem by Ayn Rand. We'll continue.
The president traveled to his hometown to make the case in front of a potential group of skeptics, the American Medical Association.
The cost of our health care is a threat to our economy. It's an escalating burden on our families and businesses. It's a ticking time bomb for the federal budget.
Again, the we, the our, it's all a group, it's all socialist mentality. And then he says it's a ticking time bomb for our federal budget. Let's get a little more out of this.
He framed the issue in terms of the government's recent takeover of General Motors.
If we do not fix our healthcare system, America may go the way of GM. Paying more, getting less, and going broke.
Hey, guess what? Guess what? I know it's a total shocker, but Barack, you're trying to put more money into a system that is already, yeah, that's right, going broke. Yeah, Medicare and Medicaid, along with Social Security, they're going to cost about as much as the entire gross domestic product of the United States sometime within the next 25 years. And within the next 10 years, as Ron Paul points out in his excellent book, The Revolution, and the CBO has pointed out, as the former Comptroller General of the United States has said, within the next 10 years, those programs are going to take up so much of the federal budget that they won't be able to pay for anything else. And they'll have to raise taxes to at least 80% for most earners in order to get enough money to pay for these boondoggles. So Barack wants to add more expense to a system that already shows it doesn't work. It has no profit and loss incentive to try to save money and streamline. There's no reason to do so because they don't have to ask people for their money. They just take their money. The government is not the market. There's no reason for the government to save money. It doesn't have incentives to do so. It doesn't have the profit and loss mechanism. But the private marketplace does. Unfortunately, Barack Obama wants to destroy the private marketplace, and we'll get to that in just a minute. Let's hear a little bit more.
Among the proposals the president laid out, more money for preventive care, alter how doctors and hospitals are paid so they aren't rewarded for ordering unneeded tests.
That one is key. Alter how doctors and hospitals are paid so they're not rewarded for, what did he say? For ordering unnecessary tests, I believe. That one, watch out. Because they're going to say that they're not going to put price caps on anything, but that's exactly what that is. They're just rephrasing it. And then we'll get to the last part where he tries to make himself look like he's working across the aisle with a conservative Republican. Yeah, you know who we're going to be talking about, the big potato head himself, Newt Gingrich.
Encourage doctors to offer more group care and offer financial incentives for healthy outcomes. Make all medical records available electronically.
As Newt Gingrich has rightly pointed out, and I don't quote Newt Gingrich that often, we do a better job tracking a FedEx package in this country than we do tracking patients' health records.
Again, right there, He says, we do a better job tracking a FedEx package. First of all, you can hear about how they're trying to destroy FedEx. UPS has been lobbying to have FedEx, which uses air travel, have to conform to the same rules negotiated by the FedEx Ground Workers Union, which will increase their expenses dramatically. I wonder why FedEx didn't want to have ground workers, because they're all unionized. But anyway, the Teamsters thing, which has really damaged UPS a lot. Now they're trying to spread their poison to FedEx, which flies through the air. But when he talks about we do a better job tracking a package, what does he mean by we? I didn't know that Barack Obama was involved in running FedEx. Did you? This company that actually runs for a profit and they actually track the packages?